Hello, everybody. Good afternoon, everyone. I'm Sayukta from beautiful Spotless Skin team. So let's connect today with our skin expert, rather, Dr. Sukhbir Singh, live from Delhi. Dr. Sukhbir is a board certified and trained plastic surgeon specializing in cosmetic surgery and aesthetic medicine with over 10 years of experience. His approach has been to focus on the needs of his patients and to deliver the highest standards and care to each one of them. It is with this belief that he started Resplendent, the cosmetic studio, in 2018. Dr. Sukhbir loves to teach the younger colleagues and share his knowledge. He has published more than 25 national and international papers and written two books, one being on prep and hair restoration. Today, Dr. Sukhbir Singh will speak on this very topic, beautiful spotless skin and rising alarm for misuse of topical steroids. Welcome, Dr. Singh.
Thank you so much for the kind introduction.
Thank you so very much, Doctor. To start with, why are we not supposed to use any cream or formulation containing topical steroids? What are the different reasons for that? Please clarify.
Yeah. So, unfortunately, in our country, though the laws are very, very clear that steroids should not be available on over the prescription, without prescription to anyone. That means they should not be available OTC, that over the counter, anybody goes and asks for a cream that, please give me a fairness cream. Yeah, bhaiya, mujhe ye problem hai, aap mujhe cream de dijiye. That's the usual language people speak, and the chemist, will just take out one cream and hand it over to you, and he'll say, oh, it's a multi-purpose cream. You have any acne, just put it. You have got any rash, just put it. You have got any pigmentation, oh, you will become white, just use it. So they just give it like a multi-purpose cream without telling the patient that if you use this cream, you can have a lot of side effects, because patients will be using the same cream for everything, and when I ask the history, it's been, some people say, oh, doc, it's in about 3 months only. Oh, doc, only about 6 months, I've been using. So people don't know that over prolonged usage, you are actually harming your skin. You're not only causing abnormal sensitivity of the skin to sunlight, which is actually leading to more pigmentation or repigmentation, if I say, but also atrophy of the skin, which in simple term means thinning or papery thin skin, which is highly susceptible to any form of injury, or, it heals very poor. Even the healing capacity of the skin actually goes off, because the barrier of the skin, which is a very protective barrier, that actually goes off. So whenever you use a cream on your face or any part of the body, I can say one thing, that please go to your specialist doctor, ask him what is actually required, and then only use a particular cream. Just don't go to your nearby chemist and say, भैया मुझे एक फेयरनेस क्रीम चाहिए, या भैया मुझे इस प्रॉब्लम के लिए एक क्रीम चाहिए. So that should not be the way out, I personally feel.
Right. So every skin is different, just like every one is different.
Absolutely.
So for your particular skin or whatever problem you're facing, you need the expert's comment or his prescription for whatever you should use for your skin. So don't just go and don't buy over-the-counter products that may cause, and that may be very, very, very harmful to you. So be aware. Right. Doctor, I would also like to ask you why facial skin is more vulnerable. Whenever we say that topical steroids are bad, it means that it's actually abusing our skin. Why our skin is so vulnerable?
Okay, so I'll tell you why we're talking about only facial skin, and why so much thought or process or research has gone into facial skin only. First of all, whenever you speak to a person, he or she, you only focus on the face, right? That's the first thing which comes into your mind or in your focus. Okay, rest of the body is comes under focus later on. Okay, so whether you talk about your eyes, you talk about your overall face, so it's the face which always comes into focus. So saying that everybody wants that he or she should have a fairer or cleaner skin, right? Whether it is a young adult, a young boy, or a young girl who's growing up, a teenager who's entering the adulthood now, and if they have got some pimples, what out, they'll just go to the nearby chemist and say, "Bhaiya, mujhe fatafat take pimple ki cream dijiye," So that's the ideology people have, that anything happens to their body part, they're not really bothered about. They might be having body acne, they might be having some problems in the body, but they're really not worried. But anything crops up on the face, I think first of all, you just go to a chemist and say, you give me some cream for that, So that is focus. Now, secondly, the most important thing is that face is the only part of the body which is highly susceptible to your sun exposure. Okay. Like even if I talk about winters, when people feel that the sun ray exposure might be less, but actually the sun exposure is quite high. Though the weather might be cloudy, but actually your sun rays are still penetrating. You cover yourself the entire body with warm clothes and everything, but it's your face which is always exposed. Right. So the exposure area is highly sensitive to sunlight, and with all the added creams and whatever you do, that actually aggravates the problem. So facial skin is always susceptible and has been always vulnerable. That's why.
Right. And you very truly said that we are so obsessed or possessive, we are so possessive about our skin that whenever a problem occurs, despite going to an expert, we'll like to go to a chemist and buy something which can do or make our skin back in the glowing status by just a snap of a finger. So we want the solution right away, but that solution may actually lead to more harm to our skin. Doctor, which are the common side effects observed due to misuse of steroids?
Okay, so as I said, very commonly, pigmentation is the most common which I routinely see. That is one thing, because people will come and say that, doc, we had pigmentation, we went to a chemist, we took a cream, we applied it initially, it showed a very good result, we had a good whitening, and then we continued using it and it became worse. So that is first thing, foremost. Secondly, because of the chronic use, you can have atrophy of the skin, which is called super thinning or papery thin skin, which I told you about. The problem with that skin is that it is highly susceptible to any form of injury. Whether you apply any other cream or any other sun exposure, that can actually aggravate, lead to some infections. It can be bacterial infections or any fungal infections, especially on your body. When you use for some itching cases, you actually aggravate a fungal problem. So you might be actually having a fungal problem, but you apply a steroid. So first of all, the diagnosis becomes very difficult that it was actually only a fungal infection, maybe something else to start with. And secondly, you're actually aggravating that problem more, So that's the thing. Also, you might have record of pimples. You might be having, the skin which becomes more blotchy. And sometimes we see that not only the face, but even the neck starts getting involved and it spreads like that, So all these things are very, very common to see that.
Right. Doctor, whenever this word steroids come, we have this theory in our mind that steroids, actually, it makes our body addicted to it. Is it the same with our skin?
Yeah. So initially, when you apply a fairness cream, which actually contains steroid or something, so initially you get a good effect, you have a whitening effect and you say, wow, this is a wonder thing, or if you apply to an itch area, any steroid cream, so that redness or the itchy part goes away with steroid. But unfortunately, people fail to understand that only one part of the issue is being addressed. The other problems, the aggravation starts because you might be having secondary infections. The problem is not resolved basically. So initially you have a good sensation, so you keep using that, but actually you are having a bad result overall. That's why your chronic usage occurs. We hardly get patients who say, Doctor, मैंने बस अभी लगाया था and within 1 week I've come to you. We hardly get patients like that. Most of the patients who are using, they have used like prolonged, for sure. It's like an addiction, I can say, which people use it to,
Right.
Yeah.
Right.
Oh,
We got
yes,
that, doctor.
we need steroid for certain indications, which are skin conditions which do require, but they are very different from what normal people use it left and right. Actually, that should not
right.
be.
And only an expert will know, and only an expert can tell us that, how it will work and how it will actually soothe our problem. So just don't be a self-doctor, don't be a doctor yourself, don't go and buy a product from a chemist shop. And doctor, when we talk about buying products, it's not only from the chemist shop that we are getting products for our skin-related issues. We are also going to normal shops, malls, beauty, online e-commerce shops, from where we have almost all the solutions. We have creams for acne, for fairness, for blemishes, pigmentation, etc., etc. What about those? Are they safe for our skin?
No, that's the problem. As I told you in the beginning, that we have a highly uncontrolled selling of medicines, whether it is online or offline. Okay, so every online portal can have any cream. There's no regulation on that. Okay, they do not market that it is steroid or only you have to have a prescription. You can just click on it, you can just buy it like that. So that's very unfortunate. Secondly, importantly, that I feel that this should not be the way out. In fact, a lot of RMPs who are uh, with all due respect, registered medical practitioner, but I'm talking about those who are not qualified specialists. Okay, so they also have a small shop next to their what do you call, I should say, clinic or something, and they also have made somebody comes to them that I have got a itch sensation, and they'll go and they'll give you, okay, use this cream. So sometimes I get patients and they say that for that cream nothing was written, they have just given me a bottle and in which they have put some cream and all, they have told me to apply that. So all these things should not be done, and I sincerely suggest all the patients that even if they are taking any bottle or anything from any RMPs also, they should at least ask them ki what is the constituents, or at least tell them to write it, so that if they go to a specialist, they know actually what has been applied, because half the time we actually don't know sometimes what has been really applied also. So that is even the most sad state of affairs.
Right. So, viewers, please be aware, just don't go and buy anything and don't abuse your skin, especially with topical steroids. Doctor, what happens? Like if I have a skin related issue, if I'm experiencing acne or say pigmentation, I may go and consult a doctor and dermatologist in this case. But if I feel that my complexion is not that fair, and we Indians and across everywhere, we have this fascination for fairer skin. So if I'll never go to a dermatologist and say that, see, my skin is not that fairer, so maybe I'll just go and buy a fairness cream, which is a very regular practice. People will hardly go to a dermatologist to say that I want a fairer skin. They'll try to do things on their own, and fairness creams are one easily available options for them. But as you're saying, that even in fairness creams, they do use steroids. It's going to be really harmful. What's your note on that? What would you like to suggest to all our viewers?
Okay, first and foremost, even when you're talking, I was just remembering this, that why all Indians are obsessed with complexion. I don't know why. Why should you be? I think everybody is beautiful in their own way. Why should you feel inferior? That is my first question, because I get a lot of patients, they'll come to you and say, डॉक्टर साहब मेरी ना बेटी की शादी होने वाली है अभी एक हफ्ते के अंदर, आप कुछ ऐसा दीजिए, ऐसा कुछ कीजिए वो एकदम गोरी हो जाए. And then tell them ki, why you want to do that? She's very good, she's beautiful. Why you want to change something, her identity itself? Yes, you should use certain creams in your regimen. That is very important. Like sunscreen, I think, is the most important cream that you should use in your regimen, daily regimen, a moisturizing and a night serum. I think these three things, if you use regularly, you will have a decent complexion. Obviously, ethnicity also determines the complexion. Some ethnicity have actually a fairer skin. Some ethnicity have not so fair, but slightly to the darker side. But I feel that everybody should be more happy in whatever complexion they have. They should just try to give some nourishment to the skin, like hydration and all, rather than focusing on only complexion. I think this word is the killing word, I personally feel, because, and especially in this social media world where everybody is on the phones and they'll apply filters, so you actually don't know what, because I certainly sometimes patients send me pictures, on WhatsApp. This is the problem. So when I see the picture, they are looking so fair, and when they come, actually, it's something different. So I ask them, they're like, "Doc, वो filter लगाया, filter use करते हैं हम लोग ना." So that's very common with our youngsters. So my only suggestion is that be yourself. You are very beautiful. So don't try to change yourself. So I personally request all of them that don't run after complexion. Yes, you have got any issues, acne, you have got any major problems, do visit a dermatologist. We'll help you out in that. We'll definitely help you out and take care of your skin, but don't run after complexion, because that is one thing which will harm you in long run. Okay, that's one thing.
Right, I completely second with that, doctor. Actually, the beauty of humanity, human race, is that we are in all color and in all sizes. That's the beauty. So please stick to that. Don't just rush for a fairer skin. Um, that's what the doctor just told us, and it's actually very correct. Doctor, now moving forward, I would also like to know that what are the common examples of topical steroid misuses?
So we have a lot of less potent and potent steroids being used. Like we have mometasone, and we have other stronger steroids which are being, like hydrocortisone. It is a less potent steroid. So there are a lot of combinations which are cream. Like I'll tell you something, like we have combination of mometasone with fusidic acid. Creams are available. So if you can, a lot of. So I'll tell you that whenever you go to a counter, if your doctor has prescribed you this combination, obviously you would have thought about it and prescribed you. But if you go to a counter and he's giving you some multiple combination cream, definitely check out if there is a steroid in that, or type in Google. Nowadays you just type the combination, trust me, you'll get all the details. So always check out what exactly your constituents are, because then only we can help you out which steroid they are using, whether they are really potent or they are less potent steroids. So that's very important. And also I've seen that along with steroids, sometimes there's a misuse of something called hydroquinone, which is also very commonly available. So nowadays there are a lot of non-hydroquinone creams which are available for pigmentation, which really help you out. So also watch out for the hydroquinone component being used and misused a lot in the market, actually, which are really available.
Yeah. So as a layman, if you don't know what steroids are, then just at least Google those, ingredients or combinations that's available on the product that you're buying. At maybe then you'll come to know that whether you are using steroids or not, and what steroids are you using. And please just go to a doctor before buying any product, especially for skin-related issues. Doctor, meanwhile, will also pick some of the questions that our viewers are, shooting towards
Absolutely.
us.
Absolutely.
Vikas Parihar is asking, do topical steroids weaken my immune system? Can they weaken my immune system?
So obviously topical steroids per se cannot weaken your immune system. Yes, if they are used along with oral steroids, then yes, they can weaken the immune system. But saying that topical steroids weaken your immunity of that particular portion of the skin where you're using the steroid. So suppose you're using something for your hand or something for your face. So that particular area is highly susceptible to a lot of injuries, external injuries, like sunlight, like secondary infections and other problems. So that way, that local area, local immune system may go down. But if you talk about overall immunity, if you're taking a lot of oral steroids, yes, your immune system will go down.
Okay. Sonia Ayer is asking, so can I put moisturizer over steroid cream? So anyway, she is, in a way advocating steroid cream.
Why is she using steroid? I want to know that.
Exactly.
Is your doctor told you? And if your doctor has told you, then definitely they would have told that you can apply moisturizer over the dryness areas, or chronic itch areas where you have, if you have really consulted a doctor for using steroids. Okay, so it all depends. So I have to know the detailed history before I really comment completely on this answer. But obviously moisturizer can be always added, but why is she using steroid? That is the main question to be asked. Okay,
right. So, Sonia, if you're not, then please go and talk and consult to your dermatologist. Please don't use any steroid cream by yourself. It's going to be very, very, very harmful. And Ashu Mishra is here asking, what happens if you are using topical steroids too much?
Obviously, I think we have addressed that point before, but we'll still talk about it, that it can lead to acne, it can lead to thinning or atrophy of the skin, papery white skin. It can lead to damage of the skin barrier. It can cause secondary infections, pigmentation, rashes, and so on and so forth. Okay.
Right. पलक दुबे हैं, आपने पूछा है कि स्टेरॉइड क्रीम के साइड इफेक्ट से कैसे छुटकारा पा सकते हैं?
छुटकारा, पहले तो stop using it. That is the first thing. And if you've used over the face, then start with sunscreen. That is the basic thing, and continue sunscreen for a lot, and contact your dermatologist who is next door. just go to your skin doctor, and I think he'll assess your skin, and then he might prescribe you what's the best for you. Okay.
Right. Gautam Pathak, what happens if you put steroid cream on a fungal infection?
I think I answered this question earlier, but still
Yes.
I'll answer it. That first of all, it worsens the fungal infection. Okay, first thing. Secondly, the diagnosis of fungal infection goes off and cannot be really made out if you have actually used steroid creams for more than 3 weeks. So please do not just apply steroid creams over any itch areas.
Right.
Sorry.
And as you said, doctor, I think it's very important, to diagnose the problem. And for that, a person just can't diagnose his or her own problem by herself. She or he needs to go and talk to an expert, a dermatologist in this case. So you think diagnosing issue is more important, then the doctor will actually tell you the whole line of treatment.
Absolutely. Diagnosis is the most important. Unless we diagnose it, we cannot come to a conclusion then what line of regimen we have to treat the patient.
Right. Okay, Bipin Patel. Bipin is asking, what should be the standard regime for daily skin care? You have already explained that you need sunscreen, you need moisturizer, you need a good night serum, but still, doctor, a little more, we would like you to elaborate
if
on
you
this.
talk about a daily skincare, I think I'll give you a very, very simple 5 thing skincare. You need a good face wash. Okay. Use a good face wash suitable to your skin, obviously, because if you have oily skin, your face wash is different. If you have a normal skin, your face wash is different. So ultimately, again, your doctor will decide what face wash. But I'm just telling you the regimen. Okay. So first is face wash. On a moist, damp skin, apply a moisturizer. Let it be there for about 10 to 15 minutes. Let it get absorbed. And then you apply sunscreen. Now, most important thing is that sunscreen has to be repeated every 3 hours. It's important whether you are inside the house or outside the house. You have to reapply. The common misconception is that I'm inside the house. Why should I reapply? You have got everything in the house which emits radiation, starting from your simple mobile phone to everything in the house which emits radiation. Okay. So you have to use sunscreen in the house. And obviously, you have to have a night serum, a good night serum. It can be vitamin C based, vitamin E based. And nowadays, we have got a lot of hyaluronic acid based serums which are available in the market, which can be really used. So I think if you follow these basic steps, I think you should be good. And last but not the least, all the girls or boys, whatever, you should never sleep with your makeup on. That means even if you're tired, dead tired, you can't, get up like, oh, I'm so tired, I can't do anything. Just remove your makeup and then sleep. Okay, that's very important. Okay, because otherwise that will dry out and lead to problem later on. Acne spurt especially. Okay,
Right.
I think I've answered that question.
That was really simple and straight to the point. Asha Thakur is here. She is asking, can over-the-counter sunscreen be used, or one should use doctor-recommended sunscreen?
Okay, Ashaji, thing is that sunscreen, yes, you can use over the counter, no problem. But ideally, sunscreen should be used with prescription because everybody's skin is different, as I told you. Somebody has got acne-prone skin, the sunscreen is different. Especially, I like to give gel-based sunscreen to people who have acne-prone skin, or especially in the summer conditions. Creamy-based, if you apply over acne skin, you actually trigger your acne more. So always contact your doctor. He or she will be able to suggest you the best sunscreen suitable to your skin. That's important. Okay.
Okay, right. Sarika Ghamal, she is asking, is steroid skin thinning permanent?
Almost, yes. If you have used over, say, about 3 to 6 months, almost permanent. It can be reversed, but difficult. Sometimes it becomes not only the damage becomes permanent, but sometimes the pigmentation also becomes permanent. Okay.
Okay. Shiva Dikshit is here asking, sir, how can I make my skin spotless and glowing naturally?
Please consult your doctor. I think that's the best way, because unless we see the skin, how can we blindly write some treatment for you? It's something like you don't know the road and you just want to drive your car and reach somewhere you actually don't know the destination about. So either you follow your Google map, or you ask somebody, or you be lost.
Right.
It's your choice. Okay.
So make the right choice.
Absolutely.
Nilesh Singh, doctor, is asking how to get good skin and glowing face without using any cosmetic, and to remove dark spots and to get a glowing skin without using any cosmetic.
Yeah. So basically, if you use the daily regimen which I suggested, along with some skincare which your doctor will suggest you, can get rid of a lot of things. And specifically, you asked for some dark spots. See, dark spots can be because of sunspot. They can be because of some pigmentation issues. Okay. So we have a lot of treatments for that. We have treatments like lasers, chemical peels, and other treatments depending upon your type of skin and what actually is there. So best is you go to your doctor, he'll examine your skin and he can suggest you whether laser will suit you or a chemical peel, or maybe a spot chemical peel might be required for you. It all depends. And don't forget to use your sunscreen. I think that's the most important thing if you really want a long-term good skin. Okay, and along with a good moisturizer and night serum, do use that. Okay.
Right. So that's the bottom line. Use a good sunscreen, even if you are inside, because the lights, your laptop light, all the radiations, they are actually harmful for you. So use
Definitely.
sunscreen, use a good moisturizer, use a good night serum. Megha Sharma is asking, sir, do steroids make me itch so it may have problem in future? I think she's trying to say that can, steroid be harmful in future?
So why are you using steroid? First of all, tell me.
Right.
That is the first thing I want to ask you. Why you want to use it? Has your doctor suggested you? And if yes, then obviously he would have thought that that condition might be requiring steroid. But I'm sure he would have suggested you to use the steroid for a very very short duration rather than continuously using it. So just ask your doctor. I think he'll be the best to suggest you. Okay. So not
Right.
it's because steroids are definitely required for certain dermatological condition. We have to use it, but for different duration of time. Okay, so he may have prescribed according to your skin condition. So always suggest consult your doctor that how long you should continue. Okay.
Right. It's very important because see, your doctor will know that how much steroid you need, what steroid you need, and how much quantity, when, where, everything. So please don't be a doctor yourself, go to your dermatologist. Barkha Yadav is here asking, how do steroids affect the brain and emotions? Please answer my question.
Okay. uh, so topical steroids will obviously okay, imagine that you had quite a clean skin and you wanted still more fairer skin, and you applied steroid creams, and now you have developed some pigmentation and some chronic pigmentation, and your skin is breaking from places, and you are really tired, and some rashes are coming, and you are confused what to do. So I think it will affect your emotion brain, will it not? It will
Right.
definitely,
It
right?
will
You feel
definitely.
depressed, you will feel, oh, where I'm trapped, what did I use, why did I use, so all these things. So first of all, why should you want to use it? My first question is that. Okay, so why has to be answered. Okay.
Right. So if you are actually going for steroid creams, first ask yourself why. Please consult a doctor before using anything on your face. Your face is really people become the face of other channels, and they become the face of nation. Your face is your identity. Please don't ruin it. Don't abuse it by using steroids. Okay, one addition to her previous question, Bertha is also asking, do steroids make me gain weight? I think in taking steroid can make
Yes, oral
one gain
steroids
weight.
increase weight, not the topical, obviously. But oral steroids will definitely not only increase your weight, it can affect your menstrual cycles, it can affect your liver, body. A lot of functions can be affected actually by that. Even gastritis is one of the most common problems with chronic use of oral steroids.
Okay, okay. Varsha Srivastav, can I drink if I'm on steroids?
I will not suggest you, especially if you're on oral steroids. It's not a good idea to take drinks on that. Okay.
Doctor, when patients come to you and they said that, I'm sure you must have gone through so many patients who have actually gone and taken or applied steroids on their face without consulting anybody. What's your first take on them? How you try to make them clear that how bad these steroids can be?
So my first question is that, did you consult a doctor or did you take it yourself? And the common answer is, I just went to a chemist nearby and he told me, yeah, this is the best cream. Second thing, I asked him, did you really check what it is? He said, no. He said it is very good and applied it. So unfortunately, people do not actually check the constituents also, though it is written very clearly. If you check any cream, it is definitely mentioned what are the constituents of that. So my sincere suggestion, if you're taking a cream from any nearby chemist, please check your constituents. It's very easy. Just see the name, type on Google, you will actually come to know what exactly it is, and then only start using it. So that's very, very important.
Right.
And yeah, so I actually try to counsel my patients that please stop using it. And I tell them that though I will start my treatment, but the reversal of this treatment may take few months also. So you be prepared for that. Don't expect that I can give you some jadoo ki, dawai, that you just apply it or eat it and your all this problem will go off. No, it will not. It'll take months together, not weeks also sometimes.
But if that patient would have come to you before using those steroids, at the moment when he or she started experiencing those skin related issues, then the time taken would have been really, really
absolutely.
less.
See, if you come for a focused problem, then we have focused solutions for you.
Right.
But if you come with already chronic usage of a lot of things and you already have spoiled your skin, then obviously we also need time. We are not magicians, we take time. And no drug is like a wonder drug that I give you a pill and you are just gone. No, it happens only in movies. It doesn't happen in reality. Okay.
Right. And for instance, if somebody has, used it for a long time, steroid-based products on his or her face, then can the damage be permanent, whatever damage those steroids have done?
So it all depends on duration, dear. If the duration has been for like a couple of months, like sometimes like once a week, I see patients who have used about more than 6 months or something for steroids, especially those who have migrated from the nearby suburb areas to the cities and all big cities, metropolitan cities. There, the chronic usage is very, very high, and there's almost a semi-permanent to permanent damage has already occurred. Though we try giving them some substitutes, but they expect the magic. But unfortunately, we do not have any magic. So secondly, the problem is also compliance, because when I tell them that it'll not take few days or weeks, maybe it takes months, so automatically the compliance ratio goes off because they're already wanting some immediate solution, and I do not have any immediate solution for them, unfortunately. So that's why I tell them.
Right. That's very important. Then whenever you start experiencing any skin related issues, please go and consult your doctor, because the more time you take, or you try to find your own remedies to make your skin be the way it was before, the more time or the condition will become more worse. So please consult your doctor immediately after getting to know that your skin is having some issues. Abhilasha Singh is asking, can steroids cause damage to my body parts or organs? And Ramesh Singh is asking a similar question. So can steroids affect my heart?
So it's all about oral steroid you're talking about.
I think so. Yeah.
But yeah, we are talking about topical steroids. So topical steroid will not affect your heart, whatever. And any body part means, let's talk about, okay, if I talk about one of the other common parts, face is one thing. Secondly, the most common problem, especially during summers, is the contact dermatitis can occur, or sometimes you have inner thighs getting fungal infections and all. So those areas, don't try to use steroid because you will actually worsen those problems. And I have seen that you not only worsen your fungal infection, but actually people come with pigmented underarms, pigmented inner thighs. So again, chronic usage of steroids and all that.
Right. So now we know that steroids are really very harmful. I'm sure when patients come to you, doctor, then of course, because you all, your doctors, your dermatologists have all the knowledge, all the latest updates about what to use, when to use, why to use. So you know exactly what line of treatment you are going to suggest to your patient. Now, before my question, I'll just hold it for another minute. Arun Yadav is here asking, how can I make my skin spotless and healthy? I think we have
We
already
have
addressed.
I think we have addressed almost all the questions. I'm also able to see the chat questions. So I
Yes,
think
yes,
we have
yes.
addressed all the questions. So nothing in specific particular, that
Mhm.
we had. The crux of the matter, I feel, is that everybody should be happy with their complexion and not be very obsessed to get a whiter skin. This white word is very damaging, I personally feel, especially
Mhm.
because they see all the filters, they apply filters, and they try to change their face. So my suggestion is that be what you are and just try to follow normal regimen rather than running after complexion and complexion. So that will not really help you in long run. That's my sincere suggestion to everyone, whoever is watching, or maybe they see later. So that's the thing.
Right, completely agree with you. Saurabh Megha Sharma is asking which vitamin is good for skin.
Yeah,
Uh,
vitamin C, E, and even hyaluronic acid-based serums, they are very good for your skin.
mhm. And does diet play any major role in reversing the topical steroid effect?
See, diets, yes. Okay, so diets per se cannot completely reverse, but yes, one thing is that if you add a lot of fruits to your diet regimen, it can actually really help you, because fruits are the best antioxidants you can get, the natural ones, the freshly cut fruits I'm talking about, not the canned juices or the canned ones. So the
Mhm.
freshly cut fruits, they have a lot of antioxidants, especially if you take empty stomach. They actually can help you reverse the signs of aging, if I talk about in general. Not topical steroid per se, but yes, definitely they'll help you in some way or the other, for sure.
Right. And how long does it take for skin to recover from topical steroids? You have already told us that it may take a lot
Yeah, it all
longer
depends on
time.
duration of the usage. Has the patient applied for how many weeks or months or only few days? It all depends
Mhm.
on that. And how compliant the patient is. Is he or she ready to follow all the treatment which you are going to suggest the patient? That's very important also. So the compliance also sometimes becomes a really big challenging for us, especially those who are traveling from outside the city. That's a big problem.
Now, as our viewers know that how harmful it is to go and apply and use a steroid-based cream on your face, a quick recap, doctor, if it's possible, for the systematic side effects of topical steroids.
So topical steroids per se will not have a lot of systemic problems, because it all depends that how much you have applied. So as I was telling you, that once your skin barrier breaks off, okay, so that particular area gets prone for secondary infections. It can be fungal infection, it can be bacterial infections. So that can lead to some systemic problems. Steroid per se will not lead to that problem.
Right.
But once you use that, the chronic fungal infection or chronic bacterial infections, they can lead to other systemic problems. So it's like a secondary effect, you know.
Right. Sakshi Sen, what should I look for in skincare products that will make them less irritating to sensitive skin?
I think contact your doctor, that's the best. Don't take any skincare product just like that. Don't take it too lightly, that I'll just go to the counter, pick up anything for myself. I think contact your doctor. I think he or she will be able to suggest you what's best for your skin, because you're yourself saying you have a sensitive skin. So if you have a sensitive skin, do not play with your skin and do not try to, experiment with your skin. Best is go to your doctor.
But doctor, what for the daily regime things like we need a moisturizer, good face wash, a good night serum, sunscreen. Sunscreen, you have said that you need to consult your doctor before deciding on a particular sunscreen. Though basic few things are there, but still for the routine things, do we need to go and actually talk to a doctor?
Yes, I feel that if you really are really worried about your skin, if you want a daily care regimen, it's always good to talk to your doctor, whoever is there, that what regimen I can follow to maintain a clear skin, at least, like suppose you have getting some on and off breakouts of acne, or you are getting some spots, as somebody said, some spots here and there. So what regimen you can follow to keep it in place, so that you don't have recurrence of it, or it should not at least get aggravated. That's very important. So you should at least be able to maintain what you are at the moment. You should not worsen out. So I think it's always better, because
Fair.
if you go online or over the counter, trust me, there are so many combinations of vitamin C, vitamin E, hyaluronic acid, that you will actually not come to know as a layman that what exactly you should use for your skin. Like face wash, I will tell you, there are so many face washes which are available. So there nowadays we have particular things which are for acne prone skin, different face wash we have. For a normal skin, we have different face wash. For pigmentation skin, we have pigmentation face washes which are made designed specifically for pigmentation itself. So it all depends.
Right.
Yeah.
Meghna is asking, steroids can harm any stages of age, I mean, irrespective of age?
Absolutely. Whether it is a small kid to adult, it can harm, especially the kids and the most elderly above 60 years. I think they're the most vulnerable, because already the immune system is low, and you apply some topical steroids to them, they worsen out very fast.
Right. So no one is perfect, but again, then there is no perfect definition of what's perfect and what's not. So be happy with what you have. Just if you have any issue, go and consult a doctor. That's more important. Don't become a doctor yourself. Doctor, as a takeaway, any concluding thing that you would like to share with our viewers?
Yeah. So thank you so much, first of all, for coming all the way and watching us live. Thank you for asking all the questions. Still you have queries, just post us. We'll try to address your answers to you. I think just a small request to all of you that don't run after complexion, fear a complexion, if I may say. You are beautiful in your own way. Do add sunscreen to your regimen, whatever regimen you're using, but sunscreen repetition is very, very important. That is the basic cream that everyone, whether boy or a girl, should use in their own regimen. That's very, very important. Okay. And whatever cream do you use, even if you're not going to your doctor, please check the constituents yourself. You can check it on Google. And if they're considering steroid, please contact your doctor whether that particular cream is fit for you or no. And do not use any cream just for the itchy sake or complexion sake. That's my small request to all of my viewers. Thank you.
That frenzy, that obsession for a fairer skin will actually and is actually making people do really worse things for themselves. So please just get out of it. Be happy with whatever you have and be really thankful and grateful to the God for whatever we have. Just take care of it. Stay healthy. Stay good. Thank you very much, Dr. Sukhbir Singh, for your valuable time. It has been very informative sessions, and for our viewers as well. It is great to hear you. We really look forward for many such sessions for our viewers in coming time, sir.
Thank you so much. Bye-bye.
Thank you, and thank you, our viewers, for your participation in today's session. If you want to consult Dr. Sukhbir Singh, you can visit to Resplendent, the cosmetic studio in Greater Kailashwan, New Delhi, 48. Contact number 011 400 73880. Contact number once again 011 400 73880 and mobile number 9919 391 For more updates, you can visit the website www.replendentscosmetics.com. REPLENDENT cosmetics.com and follow on Instagram resplendent_cosmetics. And for more information and updates on skin health and care, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all of you.